Hello, I'm Neil from MQ, and I thought what we might do to start off with is our brilliant panelists. If you want to go around and introduce yourself. So whether it's starting from Jen, will you kick us off for that?
Sure. My name's Jennifer Wild, and I am a consultant clinical psychologist at the University of Oxford, and I do a lot of work with frontline healthcare workers and emergency responders, and have a program all about developing and evaluating wellbeing initiatives to keep ourselves well in times of stress.
Hi guys, I'm Nathalie. I'm a volunteer for Colourful-Minds. It's an organisation here in London, and we look at educating people, specifically BME groups, about their mental health. Full-time, I'm a research assistant over at King's College London. I work on the e-brain study, which is looking at adolescent mental health.
Hi everyone, I'm James. Like the other panelists, and I'm sure like many of you, I have many hats. And my hat that I'm wearing today is that I'm a proud ambassador for MQ. I also work for Mind, the NHS, and the Royal College of Psychiatrists, and I believe that services, research and policy should be co-produced, and also because our mental health is co-produced. I'm wanting to support MQ because I know from my own experience and from my work that limited mental health research leads to limited options for people with mental health problems, and ultimately limited lives for people like me. So I think research has a massive role to play in improving things, improving experiences of mental health problems and outcomes. So I'm really looking forward to the discussion today, specifically around lockdown and the end of lockdown.
So thank you, everybody. Thank you. We have 69 participants, which is very exciting. So I'm gonna kick us off. So this is our MQ Open Mind, which is our podcast, which has been running for a couple of years, and we decided to take it live. So to take it into a webinar hosting, and our podcast is all about bringing together the science with people who are affected and the issues that matter, and really trying to get to the bottom of the biggest challenges and how science and research can deliver. Because at MQ, for those who don't know, we're MQ, a mental health research charity. We fund research to transform lives, to create a world where mental illness is understood, effectively treated, and one day prevented. And we're really passionate about what science can do to tackle some of the biggest issues. And I think in terms of taking this podcast, Open Mind, live, we want to tackle what obviously are the big challenges. And there is no bigger challenge or bigger issue at the moment than the coronavirus, and it impacts on us all and all our mental health. And we were talking internally in the office about what discussions should be and what we should be looking at. And one of the big things looking at this that really came for all of us was this notion that we know that the coronavirus is hitting mental health hard. You know, it has a big effect on our physical and our mental health. And the actual initial period of lockdown was a massive challenge for that. But actually, we also know that as we move out of the lockdown, that doesn't mean that mental health, the challenges are suddenly going and the issues are going. And actually, for lots of people with mental health problems, myself included, actually, we know that sometimes the easing of lockdown could actually bring even more challenges as we go. And so we wanted to sort of bring this as a first session of our Open Mind podcast to really talk about this issue, about how we can actually look after our mental health in this particular time. And you've been introduced already to our fabulous panelists who are covering the broad range of understanding of personal experience, research, and clinical experience as well. And I suppose in kicking this all off, actually, I wanted just to start really. I think maybe to start with you, James, actually, just to see, well, this issue we're talking about lockdown easing. How has this affected you? How's your experience been of this, and how would you like to share that?
Yeah, thank you, Neil. I just wanted to start off saying that it's brilliant to see so many people here interested in this subject. And I think that perhaps that shows that people are concerned about mental health and the easing of lockdown. And I think that is a good thing. I think that as a society, we're very quick to make some broad generalizations and assumptions about people's experiences. And that overlooks subtlety and how actually people experience things in really diverse ways. Even the same thing can be experienced in so many different ways. And I think with the easing of lockdown, from what I can see in the media and the narrative that I hear around it, I think we're at risk of thinking we've all been through this really terrible thing together, and that now it's going to end, and that's great, and what a relief, and we'll just carry on as we were before. And actually, I'll talk a bit about my own experience, but actually I think we know that it's not been the same for everybody. It's not been as hard for everybody. We've not perhaps all been in this together, and it's not ending for everyone. Some people have been changed in ways that they will never go back to how they were before. So I think that's really important to remember, actually. So I think for me, actually, the beginning of this time was really difficult because I'm self-employed doing these jobs that I do, and I also teach yoga, and my studio had to close. And it was really challenging to think, will I have the security to get through this time, the stability? And actually, I was very lucky after that rocky period at the beginning to keep my job, to keep a sense of meaning. And actually, it wasn't just those things that helped me. I think my experience of living with mental health problems for 15 years actually equipped me in some ways to cope with life in lockdown, because I don't know about anybody who's attending, but I've actually experienced a lot of time with my life in lockdown. I think many of us have. And that hasn't been because of coronavirus and the pandemic, it's been because of chronic serious mental health problems. You know, so I'm used to having spent months not leaving the house, not being able to participate in society, not being able to keep jobs or keep security and pay my rent and that kind of stuff. And now everyone seems to be, well, not everyone, but more people have seemed to be experiencing these things. And if I look at my friends and those who've coped perhaps the worst, this is just anecdotally, I think it's maybe the people who've never had an interruption or never had something in their way that they've had to overcome. And so in some ways, yes, it was challenging at the beginning, but I found my feet quite quickly because I had a lot of resources to draw upon from my experience of mental health. And so I thrived a little bit during this time, which I feel a little bit guilty about saying. You know, I shouldn't have had a great time during the pandemic, but I kept a sense of meaning, doing meaningful work about mental health, doing things like this, managing to teach my yoga classes online. And actually, the end of the lockdown is threatening. I think there's something quite threatening about not knowing what's going to happen next. I think it would be quite helpful if those who were in charge of decision making had a little bit of more of a handle on it themselves as well. But I think I want to be able to respond to these changes and not just be reacting. And what's specifically difficult about mental health for me in terms of it ending and things going a little bit more back to normal is that I'm really happy thinking about my mental health in terms of disability. And I know that not everybody relates to that, to identifying as disabled, but for me, my mental health stops me from doing things, stops me from participating in society. And actually, during the lockdown, the things that used to upset me about my mental health, not being able to go out, not being able to go to work, not being able to join in with friends or with society, I haven't had to face those difficulties. So it's been a bit of a break. And actually, as those things come back, I'm worried that, you know, what's going to stop me from joining in with things? It's not going to be the lockdown anymore. It's going to be my mental health that's getting in the way. And I think that is quite upsetting. And the question for me is, how do I manage that, really? And just to end, I'm sort of going off on a bit of a tangent here, but I've done a bit of research. I'm not here as a researcher, but I just finished my master's not long ago in psychology and education at Cambridge, thinking about resilience and what resilience means. And that's another narrative that we have going on at the moment. We've got to be resilient, we've got to bounce back. And one thing I think that this can really exclude people sometimes, because not everyone has a status quo or a resting place to bounce back to that's actually good. There are loads of people who are struggling for such a long time before the lockdown, whose status quo that they're going to bounce back to is actually still needing a lot of support. And it might even be that they need even more support, or more people who need more support than did before. So I'm quite worried about that narrative that we're all just going to bounce back and get along with it, because some of us will be left behind possibly. And we all perceive and experience and respond to and interpret adversity differently. So I think that one thing for research is to really listen to people's experiences of this time. I think that's really fundamental, so that we can have a response that meets people's needs. Thank you.
Thank you, James. That's exceptionally powerful as ever. And it's true, I think there is definitely something about the fact that mental health is not one thing. Actually, it's a very personal thing, and I think everyone's experience is very, very personal. It's very powerful to be able to share that. And one thing we do know is that actually it's affecting all, you know, it's more than ever before. It's really across everyone's lives, and I think actually in that sense, I guess I would ask also Jennifer and Nathalie, is there anything particular that you'd add in terms of that, about kind of your experience in this period?
Yeah, so I think just reflecting on what's been said so far, I certainly have heard this echoed with my clients, that some have felt a real improvement during lockdown of some of their symptoms, and quite a lot of concern about easing out of lockdown in terms of having to socialize again. And it's been somewhat comforting or reassuring to have a situation where they've perhaps not had a lot of energy due to depression. and have been able to say, you know, I don't have the energy to meet up on Zoom, and obviously can't meet up in person because of lockdown. But now that lockdown's easing, then there is that pressure to be quite social again, and feeling some hesitation around getting social. So I think that's something quite commonly that I've heard with my clients. I've also heard, you know, some anxiety and worry about future waves of the pandemic, and, you know, people worried that they might actually become infected. And so I think with respect to that specific concern, what I have found really reassuring is the data published on the BBC on the 24th of May. And that really looked at the objective risk of contracting coronavirus and then dying from coronavirus. And the data showed that the chances of dying from any cause within a given year, and that the chances of dying from coronavirus mirrors the chance of dying from any cause within a given year. And that risk varies depending on age. So it's obviously quite low when we're young. So for example, a 40-year-old, the risk of dying from coronavirus is around 0.01%. And that's the same risk of dying from any cause, whatever, in the next 12 months. So the actual risk of dying is 0.02%. And obviously that raises as we become older. So the risk of dying by any cause, including coronavirus, for a 90-year-old is about 20%. So I think, you know, but for all of us, it may feel like we're at a heightened risk. And I know that a lot of people feel that they're at a heightened risk. And certainly some of the behaviors that we engage in can increase that sense of threat. So constantly checking the number of deaths throughout the world, or monitoring your body for symptoms, can increase our focus on symptoms and worry about them. But I think we have to see that there's a discrepancy between how we feel and how much risk there actually is. So I think, you know, as much as possible, focusing on facts rather than feelings can help to reduce anxiety in relation to coronavirus as we come out of lockdown. So I think that might be one potential focus that could be helpful.
I'm interested, actually, as a follow-up to that one of the things that interests me is the notion that particularly as lockdown's easing, is the idea about we now have to take risks. And so lockdown was very easy because in some ways you were contained and you didn't have to necessarily, you were told you couldn't take risks. And I'm interested just in that notion, actually, that now suddenly, actually, as it's easing, it's about what sense of risks are we able to take, and I'm interested in how that might play out in a mental health sense. I mean, Jennifer, is there clinically, is there sort of something around that at all?
Well, I think I would come back to this BBC piece on the 24th of May, which really tried to break down risk and highlight that the risk of actually contracting coronavirus was really low. So for most of us, it's about 0.01%. So it's less than a percentage point. So that's really low. But I think because there's so much focus on the media, and in terms of what we focus on ourselves, and we're making sure we have face masks and we're, you know, socially distancing, I think that increases the sense of threat and the sense of risk. So I think always bearing in mind the objective risk, which we know from the data can be helpful, and of course following government guidelines. And I think if we're doing all that, the actual risk is quite low and we can leave the house and stay safe. So I think that there is that discrepancy between the objective risk and our subjective risk. And what heightens our subjective risk is what we focus on and behaviors to stay safe, actually. So like wearing the face mask is important, but actually while we're doing all of these things, it does keep ourselves focused on threat and danger and the possibility of contracting coronavirus, which can increase our sense of anxiety. So it's just important to bear in mind, these things are helpful to do, but actually the objective risk is actually very, very low.
Sure. That's helpful. And actually, Nathalie, sorry, and to you now in terms of your response.
Well, yeah, I'm gonna mirror what James said. I am naturally a very anxious person, and I found that with lockdown, a lot of my external stresses more or less went away. I'm in a position of privilege. My job's not been compromised, and I don't know anyone that's been like directly affected. So I do understand that I'm a very, very lucky person. But with that all like taken into consideration, I have been feeling a lot less anxious now than I have before. I've been able to notice my internal stresses as opposed to my external stresses, which is quite a unique situation. I feel like many anxious people will not really know this unless you move to a cabin in the woods somewhere. And coming out of lockdown, and like learning my space and my wellness whilst introducing, you know, things that might be stressful, but things that are also just necessary, like getting on a train, seeing my friends, seeing family. Finding that balance is going to be hard. That being said, it's necessary. And yeah, I mean, I think I'll find a way to navigate it just the way everyone else will. And I think just trying to be honest with yourself is a real good thing to echo. And that's something that I'm going to try and do.
It's a very good motto for us all to try and use and take. I suppose following up, Jennifer, I was going to ask, as a sort of researcher, but also a clinician, a bit about, like, what do we know about situations like this? You know, so and why are they particularly challenging? And you sort of just mentioned a bit, but I'd be interested to know a bit more on that side.
I think they're challenging for a lot of reasons. And I think, you know, as Nathalie and James have touched upon, there is safety in solitude to some degree. And then there's also change in routine, and we have to get used to a different change in routine and changes in support structures. But there's also an incredible amount of uncertainty. And I think that causes a lot of anxiety. So we can't say there's a cure for COVID or that we're certain we can prevent it yet. There are as yet no vaccines. And for Black, Asian, and ethnic minorities, we know that they're disproportionately affected by COVID, and we don't know why. So all of these things can increase anxiety, as well as the kind of individual factors that increase anxiety, what people are already suffering from. So I anticipate rises in health anxiety, for example, worry or generalized anxiety. I think post-traumatic stress for people who have had COVID and been treated in hospital. Depression maybe become a secondary problem to these anxiety issues, or a primary problem for people who struggled with lockdown and lacked opportunity for social contact.
So, and actually, Jennifer, you touched about the fact that the Black community have been particularly hit by COVID. And I suppose, Nathalie, I wanted to ask you a bit about that, and just in part of the organisation that you work for, Colourful-Minds, and the work that you do, whether your kind of reflection on that in terms of, particularly then within this period in terms of lockdown easing, whether there are some implications on that.
Yeah, definitely. I think as a Black person, and as most minorities will feel, it's incredibly terrifying, because you see it all over the news. You are constantly reminded that this awful virus, it clearly is prejudice, but just all the complexities that come with that, coupled with the fact that, you know, we've just had the whole Black Lives Matter protest. I think it's been a very scary and exhausting times for BAME people and Black people, and especially thinking ahead to this sort of like economic outfall of COVID. We know that a large percentage of working class people and people who aren't in, you know, secure, say, lower income sort of like jobs, they are going to be affected by COVID and potential, you know, I mean, I'm not an economist, but we know that there's always that word of like a recession or whatever. And we know that we are likely to be disproportionately affected by that as well. I think coming out of lockdown, it is quite, I think it's quite expected for us to feel anxious, especially, you know, with everything going on. I think we are a fantastic community. I think, if anything, COVID has taught us that we have online resources, that we have an online community, and that we can, you know, really find resources and have conversations like this, and like protect ourselves and help our friends and help others who might be going through it. That being said, it's a scary time ahead, but I have faith that we'll be okay.
I think, I mean, sort of moving on from that slightly, I want to touch a bit about your research, actually, and because your research is into parenting, isn't it, in that role? And I suppose it's a neat sort of segue into potentially that not only is it ourselves, but our role as parents in this sort of lockdown easing. And I want to ask a bit whether you might tell us a bit more about kind of some of your work in that area.
Yes, so over at King's, I'm a research assistant for the eBrain study, and we are looking at resilience in children, adolescents, and how different socioeconomic factors affect neurodevelopment. So it's a brain study, hence the term eBrain. And because of COVID, we had to rewrite the protocol a little bit to take into the fact that COVID has been a massive stressor. And that is going to affect kids. I think kids are sponges and they take up what's going on around them, even if we don't notice it. I am not a parent. I do have to put out that disclaimer. You guys are out there doing God's work. I'm not ready to be there just yet. But I think having an open conversation with your kids is probably the best thing you could do. Just talking to them about their feelings, their mental health, their worries, their anxieties, that in itself, just being able to talk about it, will alleviate a lot of the stresses. Kids are incredibly resilient. If there's anything I've ever realized from our study, it is that if anyone can overcome this, is the generation below me. I also just want to highlight that I kind of just feel like with mental health, especially like in COVID, it being so stressful and so uncertain, I keep thinking of like, you remember back in the day we could fly, you can get on planes however many moons ago, and they always told you that when the pressure drops, you will have one of those masks drop out the sky and put on yours before you put on your child's. It's kind of the same with that. Like, make sure you look after your mental health as a parent. I know it's easier said than done, but do make sure that you make time for yourself so that you can just be a good support system for your kid. But getting through COVID, if we can do this, we can do anything. So.
I mean, I declare my interest as a parent with 2 children under 5 as well. I think it's been remarkable thinking both about your own mental health, but also the impact on young people. And in some ways, it's slightly going off topic with the lockdown easing, but in fact, it's all part of the same. I mean, the number of times my son will now say to me, was that before coronavirus? What will that be after coronavirus? And he's 5 years old, and it's remarkable. And I'm really interested in the kind of impacts. I know this is slightly outside your research area, Jennifer, but I'd be interested in the kind of, have you got any reflections on that idea as well, that notion?
About parent mental health?
Yeah.
I totally agree with Nathalie. I think it's really important. I really love that analogy as well with the mask dropping down, and you have to put it on first. You have to look after your mental health in order to be a good model and support system for your child. And kids learn so much from their parents. So it is really, it's so important that you're coping well because you model that for your kids. So it's important to know what support you need that's going to help you through lockdown easing or your own anxieties around coronavirus or other anxieties that you may have, or concerns about your mental health. So I think finding out the support network that supports you so that you're well and strong, and modeling that for your children. And I think one of the things that might be helpful to, and I was recommending this at the beginning of lockdown before I knew how long lockdown was going to be, but I kept saying, it can be helpful to remind ourselves that this is temporary. So going into lockdown, it was helpful to think that this is temporary, and then like the weeks turned into months, and actually it's been quite a long time. But I do think this is a temporary period. I know it's being called the new normal, but I think, we will overcome coronavirus. And we've just had, we're experiencing a great reduction in cases and, a much lower spread than obviously at the peak of the pandemic in April. So I think we are in a temporary situation. I think that can sometimes help to deal with the uncertainty and just help people to feel a little stronger in what's yet to come. And then just also as a parent, I think it's so important. It's so easy to be critical and to blame yourself for problems that you're struggling with. And I think it's important, one, to be compassionate to yourself, but also switch the focus from what you're worried about or what you're criticizing yourself for, and focus on what you're doing that's helpful. Have the time that you're spending with your children, all the creative things that you're doing to engage them, the homeschooling you've been involved in, all these things are so incredibly helpful. And I think, parents deserve a huge pat on the back. It's been incredible what parents have achieved during this time. So I think it's important to shift that focus. And also in raising kids, I mean, that takes a lot of resilience. So I think recognizing the strengths and being a parent can also help you to feel a bit better about some of the struggles that you may have had along the way.
That's very useful advice. I'm taking that on myself. That's very useful. And I think actually there probably wasn't a better timed Mental Health Awareness Week on the notion of kindness and being kind to yourself. And actually, it's probably, for me, the most poignant Mental Health Awareness Week there's been, in that sense, how that kind of came across. I suppose, I mean, Jennifer, you're one of our amazing MQ funded researchers, and we fund a research project of yours looking at PTSD in emergency workers, which you can see on the MQ website. And I suppose that I was instantly reflecting, actually. I know that you've already been kind of involved in quite a lot of research work since COVID in terms of building the agenda and pushing it forward. I guess I wanted to sort of ask, before we kind of move on to the more kind of practical looking after your own mental health, just a bit about the research side, and about where you think kind of science and research can help us in tackling some of these issues around COVID, but also around potentially where we're going now in the current scenario.
Yeah, I think it's really important because we know that COVID is increasing risk of mental health problems in frontline healthcare workers, but also frontline paramedics. And that's the area that MQ has generously funded me for. I'm very grateful. Thank you. So we know that coronavirus is like a chronic series of stressors. So I think we have to look at research that can identify what it is that can prevent the development of mental health problems in people who are exposed to chronic stressors. So these would be our frontline healthcare workers, including frontline paramedics. We need research to identify, the best timing for delivering interventions. There's a lot of natural recovery with post-traumatic stress disorder. So do we need to rush in right away? I would say that if somebody's really high in symptoms, it makes sense to offer interventions early. And I think we absolutely need research on all of these well-being initiatives that have been developed with the best of intentions, but yet don't have an evidence base. So, we know there are loads of groups of people who are enormously stressed during this period. And again, come back to the frontline healthcare workers. And lots of initiatives have been pulled together and they're being disseminated, but they actually don't as yet have a strong evidence base. So we want to develop and evaluate an initiative and deliver what is supported by evidence rather than what is supported by best intentions. And hopefully those two will marry, and what we develop and are disseminating with the best of intentions will also gather evidence, because we want the best interventions possible to support the people who are working the hardest to stave the tide of the pandemic.
That's brilliant, a really, really helpful kind of overview. And I suppose, as you say, we know that mental health is being affected, and we know that potentially more people have been affected. But in terms of how we can get that support in there, I know James actually at a recent webinar we had, you specifically mentioned this issue actually, and I wonder if you want to talk more on it.
Yeah, absolutely. So I think I have a lot of questions for researchers around what they could possibly be researching at the moment. But I think that back to the point I was making earlier, one of my main questions is, well, what have been the protective factors? Because I don't believe that we've all been in this together. I think some people have been protected by certain things like privilege and, having certain securities that other people don't have, connections that other people don't have. And I was sort of thinking, well, what can we do for those people who don't have those protective characteristics, I suppose, especially what could we do rapidly if there is going to be a second wave, or, as the chief scientific advisor was saying today, a re-emergence of the first wave. I think that this point about evidence base is so important, and that is mirrored in my own lived experience, that when I had anorexia 15 years ago, first time, people didn't really know what to do with me because there wasn't much of an evidence base. And since then it's built so that I wouldn't have the same experience now, because evidence has changed about treatment and what works. And so I've seen in my lifetime that actually research makes a massive difference to what is offered to people. But I think that there's something around the structures of research and commissioning research and funding research that makes things a bit slow. And actually what we need now is a rapid response. And, how can we change the structures to allow rapid response research? Because I was part of the panel that had to award the £5 million Coronavirus Mental Health Response Fund, which was a pot of money given by the Department for Health and Social Care for charities to write applications for. And actually that was really challenging to know who should we give this money to, because all of these projects were great, you could tell that perhaps some of them were aimed at groups that might be more affected. But in terms of the interventions they're offering, we didn't have much information about how is this actually going to help specific effects on mental health from coronavirus. But I know some of these projects are great for well-being and great for mental health in that sense. And some of them have specific targets, but what's the coronavirus-y part of it in terms of the impact on mental health? And so, it's great that money was available, and I'm sure that it will make a massive difference. It's all been allocated now, but I think also we need support for core services in NHS services as well. But I think that point about evidence-based is so important, because otherwise you're just shooting in the dark, hoping for the best, and it will do some good. But I think we really need targeted interventions that will make a difference to people's lives.
And hopefully we can take advantage in some ways of the fact that mental health is higher up, even higher up the agenda now, and people are aware that people will be needing more help, and there's an evidence base needed, that we can do that. Nathalie, do you have any reflections on that at all?
Yeah, definitely. I am hoping that from this we start to understand that mental health there's no quick fix to it. And we are all in it for the long run here. I know that the lockdown is temporary, but this talk around mental health is something that you learn, never unlearn. So this is going to be hopefully something that sticks with people for a really long time, especially with my research with adolescents and young adults. We look at early life events and trauma, and the sad reality is that during the lockdown, there is an increase of traumatic events with the loss of parents' jobs. There's unstable living situations, food, not being able to see your friends. You don't have that community around you. You can be quite socially isolated. And I think as a community, as researchers, need to be really prepared to just understand what the impact is going to be in future, and just be proactive here. And then once again, like Jennifer said, tailor our services hopefully towards that to benefit people who need our help, not just now, but also who will need our help later on, because this is a massive event that's affected us all.
Absolutely. And moving from the kind of the situation now to a bit more about kind of the question we posed today, really, and sort of taking advantage of all of your expertise in all different areas. I did want to ask, so what practical hints and tips you might give for people in terms of reducing their anxiety? And I guess you'll all have something to say. So I'm going to go from my screen. So my top left is Jennifer. So if I can go to you first, maybe on this one.
Sure. So I have 7 tips, and I've written about them in my book, Be Extraordinary. They're practical and they're super helpful for times like this. So we've touched on one of them already, and that's focus on facts, not feelings, to overcome worry. So this would be, for example, remembering the BBC data on objective risk related to coronavirus, and then also update your images. So there's been some really cool research, also funded by MQ, that's looked at interrupting cycles of worry. And that research found that when you're worrying, if you can conjure up a positive image or an image of a possible outcome. So if you're worried about catching coronavirus, if you can picture yourself being healthy, or even just picturing any positive image like a sunny meadow, for example, that will instantly reduce anxiety. So the first tool is focus on facts. And then the second tool is tap practical thinking. So practical thinking is about solving problems rather than overanalyzing them. So it's not overthinking. So if you find you are worrying or dwelling, this is your cue to get out of your head and spot how to move forwards. And then the third tool is to notice differences between then versus now. So this is a tool that I use when I'm working with my clients with post-traumatic stress. So if we focus on how now, the here and now, today is different from our past events or difficult situations or even past trauma, noticing how now is different to the past can really help to unhook the present from the past. So that's called then versus now. The next tool is plan ahead. And this is a really simple tool. And we've done a number of studies, and this now has a robust evidence base. But basically this tool is about making a plan for your next day the night before and making sure you include a very brief, enjoyable activity in your plan, and you have to write it down. And this reduces psychological distress, and we've repeated this finding several times. We weren't expecting to have it, but it's a really simple way to reduce psychological distress. Let's make that plan the evening before for your next day and include an enjoyable activity in your plan. The next tool is to kick avoidance. So this was obviously really important during lockdown, but it's going to be very important as we come out of lockdown to make sure that, you know, we can kick avoidance. We may have become more avoidant during lockdown of socializing or of exercising, for example. So the way to kick avoidance is to make decisions based on how you want to feel, not on how you're actually feeling. So there's something I call the 3-minute carrot to help get you started. And that's to tell yourself, I'm going to do it. I don't feel like doing this. Like, I don't feel like going for a run, for example. So I'm just going to allow myself to run for 3 minutes, and then I'm going to reassess how I feel, and I'll carry on or I'll stop at that point. And then the next tool is focus. So this is the 6th tool. And this is really about noticing or spotting when you feel self-conscious. And when you feel self-conscious, that means your attention has shifted from the outside world into your body and your thoughts and yourself. So when you're when you're feeling self-conscious or uncomfortable, use that as a cue to get your attention out of your head and back into the world, and that will help to reduce anxiety. And finally, possibly the most important tool is compassion. So it's important to be kind to your mind, to be kind to yourself, to extend the kindness you so readily extend to others to yourself.
That's fabulous. And that's I should at this point, before I go on to our other two panelists, to say that we will obviously be sharing some of these things afterwards, so people who joining us today and other people can see them. So I'm going to go bottom to my bottom left now. Nathalie, over to you.
Jennifer's advice is really fantastic. I'm just going to echo on the last point she made about compassion. Be kind to yourself. This is a very strange time for everyone, and just be sure that you practice kindness to yourself. I think it will radiate from there. And then if you're being kind to yourself, you'll be kind to other people, and you know, things can only get better from there. I also just wanted to really stress the point that this is a very strange and uncertain time. What a cliche, but it's a very, very strange and uncertain time, especially for Black and other minorities living here in the UK and just living across the world. Reach out, speak to someone if you can. It's very stressful to just feel the way that you feel isolated or othered by yourself. So if you can, reach out. There are so many resources out there. There's so many people who are willing to speak, or just have a conversation with your friends. Really reach out and lean on people.
And James, to you then.
Yeah, sorry, I just had to switch the screen back because I was quickly Googling for Jennifer's book so that I could share it in the chat. So I found that really comprehensive, but the last point really spoke to me. I think about this self-compassion and remembering that you have your own needs, you know, for safety, for connection, and, you know, validation of your difficulties during this time. And I think that, yes, we do need this book now. It's what the world needs right now. And I really relate to that thing of, you know, always looking after other people and that help that you so readily give to other people. Because I think at the beginning of the lockdown, I was really focused on everyone around me and how can I support them? And, you know, how do I need to step up to support my community and my students and my yoga classes, which I think people have found really helpful. And actually, it took me a while to take a step back and think, how is this going to affect me? And the importance of having people around you who can nudge you with that and say, you know, what are you doing to look after yourself as well? I think one tip that I would have, not pretending to be a guru, even though I'm a yoga teacher, I think that it's quite helpful to sort of buy out or you know, take a break from this comparative suffering that can go on so easily. And I think that that's something I'm really guilty of, is that I'll be struggling with an issue. Maybe it's with the lockdown and eating, and how is that going to affect me with an eating disorder, and how am I going to manage in new ways when I used to rely on eating out a lot and getting stuff on the go, so I didn't have to prepare food at home on my own. And you know, I easily think, oh well, you know, other people have got it worse, and I'm not doing enough by offering what I'm offering to my community because I'm not a virologist. And I think that, this is such an easy path to go down, but I would just encourage people to give themselves a break. Whatever you're going through is absolutely valid in your life in that moment. And it's kind of the only thing you can take responsibility for, because you aren't going to become a virologist overnight unless you're already a virologist or nearly finished your PhD. Yeah. Other things that I would suggest are to reach out to people and to not be afraid to take up space. I think it's sometimes really uncomfortable for people, but having your own needs and not being afraid to even demand sometimes of other people that, I need a bit of support too. I think that is really important, and we have to acknowledge that not everybody has that support network. So sometimes it's incumbent on us to reach out, but without forgetting to look after ourselves. I think I might sort of diverge a bit and take a little issue with the facts, not feelings part, because I do really understand that. And I think I did find it reassuring to think, what is the reality of me actually catching coronavirus and dying? But at the same time, I would, as somebody with, quite difficult anxiety, I'd still feel really, really anxious. And thinking about the facts sometimes doesn't always work for me, because I then end up thinking, well, why is my body still really anxious, even though I can think sort of the opposite, and the feeling is still there. And for me, I think it's a bit of both, of recognizing the facts of the situation, and maybe my response is a little bit disproportionate because I'm quite easily triggered to feelings of unsafety, and actually sitting with it or moving with it is the way that I deal with it. So that's where my yoga practice comes in, and I'll give that a plug as well. You can always look me up. Lastly, points, I suppose, from my experience around food and eating, to recognize that this might be a very difficult time in that respect, and there is a lot of pressure and messaging coming out which is saying that you need to have your beach body ready so that lockdown ends and you unveil your six-pack, and pressure from dieting companies to monetize all of this, and we have to resist that. We have to support each other in resisting that. I think it's a good job to get out of the end of lockdown intact, or as intact as possible, never mind improved. And there are great resources from Beat if you want to look up their resources and their helplines, because they support people specifically with eating problems and their carers. Last of all, I think just give yourself a break. I think we're all doing the best that we can. And yes, some people have written their books during the lockdown. Some people have got really fit. They've done all my yoga classes, or they've improved themselves in all kinds of different ways. I think it's enough just to have got through it as best as you can, and we're all doing the best that we can in any given moment. So hopefully some helpful advice.
Absolutely. I mean, the collection of advice there, we've got enough for a second book, Jennifer, I think maybe we'll be working on, and that hugely important as well, actually. And we've got moving from kind of the tips part, and I will come back at the end to ask you your one bit of advice that you'll give, your kind of key bit. So get preparing for that one as we go. But I think moving into our kind of question and answer, because we've had lots of questions coming through, and I'm just going to try and sort of get some of these have been sent through to me, so I'm going to try and get them. But linked actually to what you were saying, James, one that's come from Craig Morris, which is a really important question, which is actually about, obviously there's, for all of us, and again, this is my personal experience saying that people with existing problems and how they can cope is a big challenge. But actually we think there may be relatively quite a few new people coming through as well, who may be developing mental health problems for the first time. Then the question Craig's asking is, how's the best way to kind of reach out to new people, in that sense? Has anyone got any thoughts on kind of how we might do that, if they're particularly at risk? James, do you want to?
I think it's just a point about how, some people we might think are going to struggle with this time. We might assume that they might struggle because they have problems that we know about. And I think it's really important to be able to reach out to those people. But again, coming back to that idea of the assumptions that we make, I think when I look at my friends, I know some of them struggle with particular things, and I'll try and ask them about that and be an encouraging friend to them. But sometimes I wonder the most about the ones who look like they're having a great time during the lockdown, or perhaps it seems like they're having the time of their life, or they're baking sourdough and banana bread and everything seems to be going just fine. And I think actually maybe I would take a few moments to message them and think, actually what is going on? And maybe it turns out that they're great and they have a new career in baking. Maybe actually they're really struggling behind the scenes. So I think that it's important to have it on your radar. It's a really good point that actually it might not just be the people that struggle with their mental health. It's affecting all of us. And actually some people may not be very equipped with dealing with this situation because they've not had to encounter difficulties in their mental health before. So those are people we need to be looking out for as well.
Either Jennifer or Natalie, do you want to add anything to that?
I just want to come back to the having just honest conversations with your friends, really. If we've lived through a pandemic together, I don't think there's any need to skirt around and arrive with the niceties. It's okay to just message your friend being like, are you okay? Is X, Y, or Z affecting you? It shows that you care. It starts a conversation. And it just lets them know that even if they're not ready to speak then, they can come back to you when they are more comfortable, when they have realized, you know, for themselves that actually they are going through something. And that's not to say that you need to be available for someone 24/7. I'm just saying that if you let someone know that, you know, there is a door there, that you have been through it, or that you can direct them towards better resources, that's a really kind thing to do, and a really good thing to do, especially for people who are new to the mental health journey.
And I guess just to add to that, I think we want to reduce stigma so that people can come forward and talk. I think sometimes the challenge is, and sometimes I've seen this with my clients, they didn't realize they were struggling. So it's difficult to then say, I need help. And I think that is a particular challenge. So I think one way to help that is for us all to be involved in the conversation around mental health, putting it on the agenda and making sure that it's acceptable and easy for people to talk about mental health. And then reducing stigma as much as we can. And the way to do that is to make sure that we're continuing to be aware of it. And I think, you know, again, it comes back to compassion. So I think if we can approach our friends, colleagues, organizations with compassion and make it a safe space to actually, you know, make it comfortable for people to recognize what's going on or what's difficult for them, then they'll be more likely to come forward. And then we can, you know, there's so many resources, you know, Mind, the mental health charity, for example, has a lot of mental health resources that somebody could just Google about. So I think there are a lot of resources online, but I do think the challenge is helping people to identify when they are struggling. And, you know, one group that's really been struggling are parents, you know, parents who have been like juggling or like potentially have lost jobs and then having to homeschool, or single parents. And I think, you know, how do we outreach to, you know, struggling parents, for example? I think it's a challenge. And I think that the more we can normalize it and, you know, make resources more widely available, the more people are going to come across them online and be comfortable speaking to their own friends and support networks. I think that's one potential solution.
That's a really useful message, not least because I think a lot of the focus is on, you know, we need to be getting the help in there now. And actually, it's interesting to think that, and I think it's really key we are getting the help in there. And for us at MQ, in terms of actually building the research and the evidence base to understand that, but there is still always a need, particularly if we're more talking about to actually tackle that stigma point. Amy Zara's got a question that links and takes us slightly back actually to what we were talking about before, which is about advice on handling conversations who might be hesitant around the easing. So really going to the issue we're talking about today. Do any of you have any particular advice on how you might kind of handle those conversations?
So the question is how to have conversations about coming out of lockdown.
Yeah, so yeah, and for people, well, actually, there's two parts to the question. So how do we help people who are nervous, and how can we help that? But then the second part of that is how can we actually work with people who might be sort of, who might not even understand that, who might be a kind of barrier to that, almost saying, "Oh, just go and do it, it's fine," type thing. So we tackle the first one. How can we help people who are nervous the best way?
Well, I think there are two ways to help people. So we can help them as friends. So if your friends are nervous about coming out of lockdown, I think, you know, making sure that you're well and, you know, you have a plan that you're working towards in terms of helping you to come out of lockdown, but then also extending your support to friends can be helpful. And, you know, brief meetups, talking on the phone, finding out what their concerns or anxieties are about coming out of lockdown. And it might be socializing again, or, you know, some people, you know, feel overwhelmed with socializing or crowds or going on public transport, all of these things. I mean, it's such a different world now. You know, if we do go on public transport and these other situations where we would expect to have lots of crowds, it's much more sparse. So I think, you know, finding out, I think it's always helpful to be specific. So finding out what it is your friend is worried about, what they think will happen, and then how you can support them. And that might be going into situation briefly and focusing on what they can see rather than how they're feeling. Because once we're in a situation where we're anxious and we start focusing on our anxiety, then we can feel quite self-conscious and uncomfortable, and then feel like we have to flee. And then we don't discover that our fears don't happen, for example. So I think that could be one way around it. So being specific, what they're worried about, what they think will happen, and then how you can support them. And then the other question was around, well, what if people don't know that they have anxieties coming out of lockdown? So I think to some degree, if somebody doesn't know they have anxiety, then I would, assume all is well, make plans to meet up, and then it's in the meeting up or in the steps of going out of the house that anxiety might become apparent, and then offering support around that. So what it is people are worried about, what they think will happen, and then how you can support. But if somebody doesn't know they're feeling anxious, sometimes you have to move towards a situation, getting into a situation in order to know how to intervene.
Brilliant advice. And linked to that, James, I'm interested in that, and all of you I suppose as well. So James, for example, has there been a situation where you've had friends who haven't quite understood if you've been nervous about anything going out again, or that side of it, and how have you dealt with that?
Not personally myself. I think I would mirror that thing around not making assumptions that people can join in. I think I had an experience earlier on in the lockdown where I felt kind of left behind a little bit, because for me, actually, I found it quite anxiety provoking to communicate with people in different ways. And that meant that I didn't actually do a Zoom with anyone of my friends, apart from a couple of times with my family, for the first 6 weeks of lockdown. I think it was 6 weeks in that I spoke to a friend on Zoom, because I just found that something that felt really anxiety provoking for me. And at the same time, I was sitting there on my social media, noticing everyone's going to pub quiz, or it seems like everyone's going to pub quiz, everyone's having house parties, everyone's having watch parties, and I felt like I couldn't really join in. And part of it was that people weren't really offering me to join in some instances, but another part is that I personally found it really, really difficult to overcome that barrier. And once I did, I tried to make it a bit of a routine and think about, well, what actually works for me in that. It's easier for me if I do it, for example, straight after I've taught a yoga class, and no problem teaching a yoga class on Zoom, but I have a different degree of social anxiety around intimate relationships. And so I thought, well, if I schedule that in, rather than letting it be an abstract idea that might or might not happen, I'll choose a time, I'll choose an easy time, and then that made it happen. And that's something that we can encourage our friends who may struggle with things as well. I think it's that point around, many people just don't think about the issues that people might have. And you might be in a group of friends who just think, well, why can't you just come along? Why can't you come down the park and have a drink? Why can't you join in? And those maybe aren't particularly understanding friends. There's a question there around, how much effort do you need to put in, or can you put in to educate your friends about, it's not that easy for everybody. Or whether you want to be mixing around with those people. But I think that it's making these assumptions about people being able to join in, and it's great now that you can go back and do X, Y, and Z, when actually that might have been difficult in the first place. Like for me, socializing was a bit stressful in the first place, or it might be worse now because there are additional fears involved. So I think that being like a good friend to yourself, but being a good friend to other people as well, really involves actually quite active conversations, like Jennifer said. I think specifics around what is it exactly that might be difficult in that situation, and how can I help you? Because I think a lot of reaching out isn't actually helping share the responsibility. Sometimes it's, we might relate to this, it's friends who say, I'm here whenever you need me. And I might not feel like I can message that friend unless they say to me, what exactly is going on for you? I really want to know, and how can I help? And I think that these are ways in which we can model that, and actually not put the responsibility on the person who might be really struggling, because they're already holding a lot of work, and helping them to break it down into smaller steps could be one of the great ways of being a friend to somebody.
Nathalie, was there anything you wanted to add at all on that?
No, everyone was spot on there. Everyone said good things. Yeah, I have nothing to add to that.
Well, I guess I'd follow up from one of the questions we had from Lauren, which is actually about this issue of social anxiety. And it's a question really, in part for Jennifer. do we think there is she asked, do we think there's a risk that we could see an increase in social anxiety because of people being worried about going, or will there be any impact on these sides? Is anyone looking into that?
Yeah, I think that's a really great question. And I think there certainly was an increase. We were expected an increase in social anxiety during lockdown, because when people feel anxious, Zoom isn't an easy platform. So we were encouraging people with social anxiety to take a Post-it, just a simple Post-it like this, and then just to put it over their image so they couldn't see themselves when they were meeting up with friends. Because when you can see yourself, that can increase the sense of self-consciousness, and then, you know, bring on the feelings and increase the sense of social anxiety. So there were like helpful tools like that. But of course, you know, we've gotten into this routine during lockdown, and coming out of lockdown, I think there is going to be an increase in social anxiety for people who are socially anxious already. So because they're going to have to meet, well, not, they're not going to have to, but they may choose to meet up with people in person. Which I think is a good thing, and it's important that we don't let avoidance kick in. But it's also going to be important to drop any sort of safety behaviors in terms of, censoring what you're saying, or trying to cover your body if you feel self-conscious about sweating or blushing, for example. And again, it comes back to what we focus on. When we focus on these things, we increase the sense of self-consciousness, which makes us want to run and hide. So one tool for really helping social anxiety is to spot when that feeling of discomfort comes on, and then really notice where you are and what other people are doing, the content of a conversation, and try to get out of your head as much as possible. The overanalyzing and the censoring and the safety behaviors actually increase the anxiety. So as much as possible, if we can get out of our head and into the situation, into the world, or into the present moment, for example, then that can really help to reduce anxiety. So I'm not sure we'll see an increase in social anxiety, but what I do think we'll see is an increase in social anxiety for people who already have social anxiety.
Yeah, that's brilliant. Putting a scientist on the spot to tell us what's going to happen is always a challenge, and that's a very brilliant answer. There's been a few questions have come in actually, and actually at this point I'll say we obviously, it says it's going to finish at 6:30, but we did take the liberty of saying we add on 15 minutes for questions. So hopefully everyone can stay, and we've had lots of great questions. So there's a couple more that I would love to still ask if I'll keep going. So one's from Donna, who had a few that is, and she's a mental health first aider. And I suppose that, and she's interested in kind of the workplace, I suppose, and it's maybe an extension of what we've been talking about. And I'm sure a lot of the things you've all been mentioning are the same, but is there anything in particular about how you can support colleagues? Is there any thoughts, and particularly in the new context and the new world we are in terms of working from home and everything?
So I'm no expert when it comes to this, but my boss is a psychiatrist. I'm very, very lucky, and she has done a really good job of just making sure that we all find a working style that works for us, and holding us accountable to that, so that we're not having, Teams meetings every hour on the hour if that's not what works for us. Making sure that we say that we're going to finish work at a certain time, and we finish at that time and not work until like 6, 7, 8 or 9. And I know that's a privilege in itself because of my job, but I have colleagues that hold me accountable and I hold them accountable to just do the work that we need to, and to be compassionate in the workplace. We're not going to work at our maximum capacity, but we're still turning out really, really good work. So I would advise people to just have a conversation with their colleagues about how they're finding working in lockdown, what they can do to make it better, and then just continue to check in to make sure that they're doing those things, so that they don't burn out or, just end up hating their jobs.
So I think that's brilliant, Natalie. And I think to add to that, I would say it's so important to recognize and praise your colleagues for what's going well and what they're doing really well. I think it's been a really challenging time. A lot of teams have been even busier than before lockdown. And I think taking some time in a meeting, maybe once a week, just to congratulate people on doing a great job, what it was, that's been going really, really well. And just making sure that you're highlighting all the good stuff, rather than just noting all the work that still needs to be done. So I think that can be really helpful. And then making sure that you're compassionate to colleagues' anxieties about returning to offices, for example, because people's levels of anxiety around coronavirus will vary. Some colleagues may not be that worried, and some colleagues may be quite worried about it. So making sure that one, people aren't isolated in returning back to work, and that obviously safe practices are in place at work. So, you know, obviously it's safer with fewer people in the office, but ultimately we don't just want one person in the office, because that's quite an isolating experience.
That's very useful practical advice there. James, did you want to?
Yeah, I think from my own research, very small project into resilience, I think that I learned that resilience isn't just about that bouncing back to how you were before continually, but actually there's something in there about being able to be changed by your experiences and to learn from them. And I'm wondering, like, when it comes to the workplace, do we actually all want to go back to how it was before? Haven't we learned perhaps new ways of working that we want to keep? And I would encourage people to sort of retain some of those things that might have worked for them, and hopefully people don't have to fight for them, because I know that many people have wanted to work from home for a very long time if they've got disabilities, and it was impossible. You know, we can't possibly allow that. It's rocking the boat too much, and then overnight it was possible. Same in mental health services. You know, we can't do Zoom or Microsoft Teams or whatever platform treatment, and then overnight it was absolutely fine because we had to work like that. And some of these things I think we want to keep, and certainly in treatment settings, I know that people will be keeping virtual meetings. And so my worry is that, especially with pressure perhaps from the government, employers will be wanting to get people back in, and people might feel forced to go back in. And I'd encourage people to, you know, stick up perhaps for what's worked for them and trying to keep some of that and not feeling forced to go back in. Because, and then again, not to get into that comparative thing of, oh, well, you know, at least I've got a job, so I'll just go with it. Many people don't have a job, and so denying your feelings and your preferences. So trying to engage with what's working for you. And then aside from that, how to support colleagues. I think all those things about supporting friends probably apply.
Absolutely. Again, I think you've teed up the kind of next question again, James, pretty well there, and which kind of comes into access to care. You mentioned about the fact that, you know, some people may be going into remote care now, and we had a question from Felicity, which I really wanted to raise, which was that many people may have had their access to care affected. You know, we're in a new way with with care and everything, or reduced, or potentially altogether stopped. It's in her question, I suppose. How can we make sure that we support people, particularly in that group? How can we address that? I'll go to Jennifer first, potentially as the clinician.
So this is access to mental health care.
Yes.
So a lot of services have moved to remote working, and I think as we're coming out of lockdown, you know, actually they're going to continue with remote working in many cases, and offer some people the choice to attend in-person appointments at their clinics, or to continue with remote working. And I think it's helpful to take a step back and actually ask what works for you in terms of going into a clinic or with remote working, because there are advantages to either. Obviously, you know, when you have remote working, you're in the comfort of your own home, and you reduce travel time and travel costs. However, you may have children at home. You know, it may be difficult to find a private space, for example, to have treatment virtually. So it may work better for you to go into the clinic. So I don't think we can give a blanket statement to people that, you know, you should have in-person treatment or you should continue to only have remote treatment. So I think giving people the choice always improves accessibility. So if we can continue to give people the choice about the mode of treatment that they receive, I think that's going to help. So I think that would be my advice. And if you are on the receiving end of receiving treatment, knowing that you have choice and really taking a step back and thinking about what works best for you. And it might be a combination as well.
Can I ask a very practical question then, because it links into this question, which is for someone that's on a waiting list, what practically would you advise they should be doing in this situation?
Well, I think, you know, when you're on a waiting list, I think it depends what your difficulty is. So, you know, with anxiety, for example, you know, one of the things that you can be working on, if possible, when you're on the waiting list, is trying to reduce avoidance of situations where you feel anxious, and maybe having some support with that. If you have access to friends who can help, go into situations that might be a bit anxiety provoking for you, not hugely anxiety provoking, but just making sure that you can leave the house a little bit and not completely staying at home all the time. Just breaking down avoidance can be quite helpful in reducing anxiety in the long run. And then with depression, I think it's important that there is a little bit of that you have routine. You know, it's so important to have routine, and it can be so difficult and challenging for everybody in lockdown, but also ultimately when you're really depressed, to actually get out of bed in the morning and get up and showered and dressed. And so I think giving yourself a routine, giving yourself a plan during the day with a little mini goal to achieve is going to be really important on the waiting list before you have access to treatment.
Thank you. James, did you want to come in there?
Yeah, I think that I think the idea of choice and you know, what do you want in your treatment is really, really important. But I think that's quite a luxurious image of the state of access to mental health services. And I think that's one thing I'm really worried about during this time, because I think we can't pretend that in a lot of parts of the country, for lots of different people with different conditions, it is not easy to access services, and it hasn't been before, and it might be worse now. And what I'm really sort of concerned about is the support that should be being put into NHS services to really ramp up the capacity. And I'm not sure that I've seen any increase in core funding for mental health services. I can't identify any announcements about that. There's the £5 million for charities, which is probably peanuts, but some of the stuff that these charities are suggesting they'll do should be core NHS services. And it's frustrating to watch press briefings, for example, from Downing Street, where people don't feel confident answering questions about mental health, or mental health questions get answered with, there is the Samaritans, or there is a charity that you can go to, when actually what people might want to know is, what NHS services could I or should I be accessing right now? And I think that it's great, the community stuff that we've seen, the community support, the support that we're talking about offering to our friends, but that is not professional support. And yes, it makes a difference to people's quality of life, but it's not necessarily what people need. And so I would really want to validate people who are struggling to get support. Or I'm on a waiting list. I was referred in February for eating disorders treatment, and nothing as of yet is happening. And I think that these people need to know that it's not their fault, and actually they're living perhaps with very desperate needs in some situations that aren't being met. And I think we shouldn't pretend that isn't the case. Not that anybody was.
No, thank you. Thank you. We are now at 18:45, so we actually are our close time. Nathalie, was there anything you wanted to add on that question? Well, I mean, it just remains really to say a huge thank you to our panelists. I meant to say all the way through that you must check out James on social media for his yoga, which is absolutely fantastic. Some of the poses you can see there are quite incredible. And just to thank all of you, I suppose, in terms of for James, Jennifer, and Nathalie for the combined expertise, both the kind of what I think big takeaways, the kind of clinical and practical expertise has been really useful. And I say we'll be collating that at MQ and sharing that. But also just the general message that we know there are some huge challenges, but we also know that actually people now are obviously talking more about mental health, and therefore with that we can do that in a compassionate way, which is really powerful and really important. It's really hopeful, the messages that come from all of you on that one, and that's hopefully what we can be doing from here. So I want to say obviously a huge thank you to all of you. A huge thank you to the currently 58 people that are listening and have been following this as it's been going. It's been absolutely brilliant to have you here, and thank you for joining us. Thank you for those who have been long supporters for MQ. Thank you to those who are new to us and donated as well for this. This is a start of our new series, so stay tuned on our social channels, and we'll be announcing our next session next month. We'll be looking at Black mental health matters. Working again with Colourful-Minds, which is really exciting. So look out for dates on that. And in the meantime, have a really lovely evening, and I hope to see you at our next MQ Open Mind Live. Thank you.
Thanks, everyone.
Thank you, everyone. Thanks for joining.
Cheers.
Thanks for having us. Bye.
Bye.